If type 2 diabetes were an infectious disease passed from one person to another, public health officials would say we're in the midst of an epidemic. This complex disease is striking an ever-growing number of adults, and with the rising rates of childhood obesity, it has become more common in youth. The good news is that prediabetes and type 2 diabetes are largely preventable. About 9 in 10 cases in the US can be avoided by making lifestyle changes, and these same changes can also lower the chances of developing heart disease and some cancers. Which changes, you may ask? Well, stay tuned to find out. But before we get to the countdown, be sure to hit the subscribe button and turn on the notification bell for more timely updates. With that said, let's start the countdown. Number 10. Choose carbs carefully. Diabetes doesn't mean you have to cut carbs completely. Choose carbohydrates that break down in the body slowly, providing steady energy. Eating sugary foods and refined carbs can put at-risk individuals on the fast track to developing diabetes. Your body rapidly breaks these foods down into small sugary molecules, which are absorbed into your bloodstream. The resulting rise in blood sugar stimulates your pancreas to produce insulin, a hormone that helps sugar get out of the bloodstream and into your body's cells. In people with prediabetes, the body's cells are resistant to insulin action, so sugar remains high in the blood. To compensate, the pancreas produces more insulin, attempting to bring blood sugar down to a healthy level. Over time, this can lead to progressively high blood sugar and insulin levels until the condition eventually turns into type 2 diabetes. So, reach for whole grains, nuts, and fresh vegetables and fruits. Yes, you can eat fruit even though it's sweet. It's about eating the right amounts of carbohydrates at each meal. A registered dietitian can help you learn how much is right for you. Number 9. Lose weight if you need to. Although not everyone who develops type 2 diabetes is overweight or obese, the majority are. What's more, those with prediabetes tend to carry excess weight in their midsection and around abdominal organs like the liver. This is known as visceral fat. Excess visceral fat promotes inflammation and insulin resistance, which significantly increases the risk of diabetes. Although losing even a small amount of weight can help you reduce this risk, study shows that the more you lose, the more benefits you'll experience. There are many healthy options for losing weight, including low-carb, Mediterranean, paleo, and vegetarian diets. However, choosing the right way of eating that you can stick with long-term is key to helping you maintain the weight loss. Start small. If you're overweight, shedding just a few pounds can improve the body's ability to use insulin. It'll help lower your blood sugar and improve your blood pressure and blood fats. You'll also have more energy. Aim to burn more calories than you eat. Number 8. Be active. Exercise. Exercise increases the insulin sensitivity of your cells, so when you exercise, less insulin is required to keep your blood sugar levels under control. Many types of physical activity have been shown to reduce insulin resistance and blood sugar in overweight, obese, and pre-diabetic adults. These include aerobic exercise, high-intensity interval training, and strength training. Pick something you like: walking, dancing, biking, or just marching in place while you're on the phone. Do it a half hour a day or work up to it if you need to. Exercise can help you lower your cardiovascular risk, cholesterol and blood pressure levels, and keep your weight down. Exercise also relieves stress and may help you cut back on diabetes medication. Number 7. Manage stress. When you have diabetes, stress can cause your blood glucose levels to rise or fall unpredictably. Get rid of whatever physical or mental stress you can. The mind-body connection means that if mental health improves, physical health may also improve, including bodily processes that can lead to type 2 diabetes. Consequently, it's beneficial to find ways to relax. Learn coping techniques to deal with others. Relaxation techniques such as breathing, exercises, yoga, and meditation may be especially effective if you have type 2 diabetes. Number 6. Say no to salt. Reduce the salt in your diet may help lower blood pressure and protect your kidneys. Not salting the food on your plate may not be enough. Most of the salt in Americans' diets come from processed foods. So, avoid convenience foods and use fresh ingredients when you can. Season with herbs and spices instead of salt when you cook. Adults age 51 and older and individuals with high blood pressure, diabetes, or chronic kidney disease should talk with their doctor about how much to reduce their sodium intake. In general, people with diabetes should decrease to less than 2,300 milligrams per day. However, your doctor may recommend lower amounts. Number 5. Break your smoking habit. Smokers have a 30 to 40% higher risk of type 2 diabetes than non-smokers. In addition, the more a person smokes, the higher their likelihood of developing the condition. Moreover, people with diabetes who smoke are 2 times more likely to die prematurely than those who don't. Conversely, the sooner someone quits, the earlier they'll experience the benefits. Quitting helps your heart and lungs. It lowers your blood pressure and the risk of stroke, heart attack, nerve damage, and kidney disease. Studies show that insulin becomes more effective 8 weeks after an individual quits. Insulin is a hormone that lowers blood sugar levels. Number 4. Watch portion sizes. Whether or not you decide to follow a low-carb diet, it's important to avoid large portions of food to reduce the risk of diabetes, especially if you're overweight. Eating too much food at one time has been shown to cause higher blood sugar and insulin levels in people at risk of diabetes. On the other hand, decreasing portion sizes may help prevent this type of response. A 2-year study in pre-diabetic men found that those who reduced food portion sizes and practiced other helpful nutrition behaviors had a 46% lower risk of developing diabetes than those who made no lifestyle changes. Another study looking at weight loss methods in people with prediabetes reported that the group practicing portion control lowered their blood sugar and insulin levels significantly after 12 weeks. Number 3. Light to moderate alcohol consumption. Evidence has consistently linked moderate alcohol consumption with a reduced risk of heart disease. The same may be true for type 2 diabetes. Moderate amounts of alcohol, up to a drink a day for women, up to 2 drinks a day for men, increase the efficiency of insulin at getting glucose inside cells. And some studies indicate that moderate alcohol consumption decreases the risk of type 2 diabetes. However, excess alcohol intake actually increases the risk. If you already drink alcohol, the key is to keep your consumption in the moderate range, as higher amounts of alcohol could increase diabetes risk. If you don't drink alcohol, there's no need to start. You can get the same benefits by losing weight, exercising more, and changing your eating patterns. Number 2. Avoid sedentary behaviors. It's important to avoid being sedentary if you want to prevent diabetes. If you get no or very little physical activity and you sit during most of your day, then you lead a sedentary lifestyle. Observational studies have shown a consistent link between sedentary behavior and the risk of diabetes. In fact, a large analysis of 47 studies found that people who spend the highest amount of time per day engaged in sedentary behavior had a 91% increased risk of developing diabetes. Changing sedentary behavior can be as simple as standing up from your desk and walking around for a few minutes every day. Unfortunately, it can be hard to reverse firmly entrenched habits. So, set realistic and achievable goals, such as standing while talking on the phone or taking the stairs instead of the elevator. Committing to these easy and concrete actions may be the best way to reverse sedentary tendencies. Number 1. Eat a high-fiber diet. Getting plenty of fiber is beneficial to gut health and weight management. As a matter of fact, studies in obese, elderly, and pre-diabetic individuals have shown that it helps keep blood sugar and insulin levels low. Fiber can be divided into 2 broad categories: soluble and insoluble. Soluble fiber absorbs water, whereas insoluble fiber does not. In the digestive tract, soluble fiber and water from a gel that slows down the rate at which food is absorbed. This leads to a more gradual rise in blood sugar levels. However, insoluble fiber has also been linked to reductions in blood sugar levels and a decreased risk of diabetes, although exactly how it works is not clear. And with that, our list ends. However, there is still a question we haven't answered, and we're sure it's nagging you. So, what if you already have diabetes? Guidelines for preventing or lowering your risk of developing type 2 diabetes are also appropriate if you currently have a diabetes diagnosis. Achieving a healthy weight, eating a balanced carbohydrate-controlled diet, and getting regular exercise all help to improve blood glucose control. If you take insulin medication, you may need more or less carbohydrates at a meal or snack to ensure a healthy blood glucose range. There may also be special dietary needs for exercise, such as bringing a snack so that your blood glucose doesn't drop too low. For specific guidance on scenarios such as these, refer to your diabetes care team, who are the best resources for managing your type of diabetes. And that brings us to the end of this video. We hope you enjoyed it, and just be sure to subscribe to our channel for more of our awesome content. And please give us a like and share the video. And don't forget to turn on that notification bell for timely updates of our new uploads. We value your feedback, so feel free to share your thoughts with us in the comments section down below. I'm Mickey V, and I'll see you in the next video.